So we are week 4. Next exam, it's week 7, because I know that's going to be a question that you have. Week 4, also, what do we have coming up there? Remember that you do have your discussion question and you do have CJ Sims. I'm a little behind. I apologize. I'm actually, for Indianapolis, I'm actually teaching your pharmacology course now. So it is a big course and I've been working with it. So I'll be catching up on all those discussion questions, making sure that they are the correct ones. And of course, not penalizing you because I'm late doing it. Okay. And then, of course, CJ Sims, make sure they have all the components of it so I can score it correctly. Um, and then next week, of course, you're going to come to class and be ready for quiz 3, which is on this information. So, week 4, had an exam. We don't have much time. But what I know is to give you a Kahoots, I'm going to give you everything that you need here. And then again, you do have the PowerPoint already. And anybody who needs any more help, clarification, wants to go over it, I'm more than willing to open some time up and sit with you and making sure that, do you get it? I mean, week 4, it's sensory impairment. It is family-centered care, and it is the variations. And what does variations of nursing care mean? Well, how you take blood from a newborn is different from an adult, isn't it? We do those heel sticks on newborns. That's one of the things. Sizes of things. All right, let's get going. So get out of here. Pretty decent time. 45 of them. Early detection of a hearing impairment is critical. Which one is of primary importance? Okay, so how would you know a child couldn't hear? What would be the first thing you'd go and look? Well, isn't it if you can hear, your speech is going to be clear, right? If you can't hear, what's going to happen? It's going to be garbled. The pronunciation's not going to be correct. So if you see a child that you are worried or they're not reacting to things, we're going to do look at the hearing, we're going to look at speech, going to look at hearing, and they go hand in hand. A multi. A toddler playing outside gets a laceration on the forearm and he needs stitches. We can make this easier. So remember toddlers. They don't like being cut. They don't like blood. They feel like they're going to die. That's that toddler preschool area, right? So they need stitches. What are they afraid of, right? Well, because they know it's stitches and they think it's needles, which it is, we're going to, of course, number one, take care of that pain. We're going to put that numbing cream on. Also, distraction and toddlers and preschooler works amazing. Child life is a newer type of a position that are used in pediatric hospitals, in some of the adult ones. But what it does, it teaches that person about what's going to happen in a developmental level that's appropriate for the child. So a school age child is going to be taught different than would be a toddler, just the verbiage, the terminology. So that's what we'll do there. A parent recognizes that their toddler has a speech delay compared to their older siblings. What's your priority? The parent says, speech, something's going on here. Brother and sister were talking, sounded differently. So again, remember what goes hand in hand with speech? Speech, hearing, hearing, speech. That's the concept I want you to know. Multi. What are signs of an early indicator of impaired cognition? Well, cognition is the way you think. All right. Impaired means you're just not doing things up to that level, whether it's fine motor skills, gross motor skills, could be speech, all of those things. If it's not where, it should be, these are those things that are delayed. Well, by 1 year, they should be saying one word, right? Nana, papa, mommy, daddy, right? They should be able to grasp voluntary any object like a rattle. Now, why is behavioral difficulties an early indicator? Well, if you can't express what you want or need, wouldn't you be upset? Wouldn't you behave badly? Because you can't. I want you to understand me. And that's that behavioral. A child's being treated for a fever. The reason for treating the child's fever is what? What's the real reason? Why do we treat a fever? I mean, we could go different ways. Well, because you don't treat the fever, they might get bad things happen. But really, that's not the real reason why we treat it. And the real reason is, how do you feel when you have a fever? You feel achy. You don't want to eat. You don't want to move. How do you treat fevers? Well, we'll give the acetaminophen, we'll give ibuprofen, but we want them to eat and drink fluids, right? If you have a young kid, a toddler, preschooler, school age, they have a fever, they're not going to drink. So you are not taking care of their what they need to replace the fluids that are being burnt off with the fever. So it's only relief of discomfort. Do you realize a child can have a fever of 105 and not have a seizure? But they can go from normal temp up to 105 in 20 minutes, and that child will have the seizure. It's the rate of rise that caused it. Okay. A multi. A child complains of something is in their eye and it's causing it to tear and it hurts. What should you do? So remember, the eye is a really, a delicate organ, right? So we can look if there's floaters, and we can take a little tissue and we can get it out. But if something is sticking in there, not moving, we're going to be putting on something called a Fox shield. And all it means is a stiff eye patch that won't rub against the eye. It'll protect it so we can get it to the eye doctor. And of course, we're going to look, does that pupil react? Is that eye still, quote, good? Separation anxiety and a child hospitalized. Which behavior indicates the stage of despair? Remember, there's three stages. They scream, they yell, they regress, and then they don't want mommy or daddy around. And those are the three stages. You see this a lot, especially in toddlers. They want their person with them. But what you see in despair is like, they're done crying, nobody came, mommy's not here, and they realize I'm here alone. And then all of a sudden, they start sucking their finger, or they're incontinent, they regress, they start doing behaviors from regression. It's that comfort. That's how they alleviate that stress. And then the third stage, of course, is where mommy and daddy come and they ignore them. And why they ignore them is because when they leave again, they're going to hurt again. So if I don't see you there now, you're going to leave and it's not going to hurt as much as the first time. It's basically the third stage. A child with a history of abuse. What therapy explores emotional problems? So we've talked play and how important play is, right? Play is non-threatening. And a child will play with toys, and it's not going to be something that, will make them like, I'm not going to do that. It's fun. And all it's called is play therapy. So that's the emotional problems. What's going on? You can show through toys and items what's causing them to be upset. A multi. What can children react to the stress and anxiety of hospitalizations? And this question's saying, are they upset before, during, or after? They know they're going into a hospital. They've been scheduled to have, say, tonsils out, big common surgery for young children. They upset. Well, anytime they can be upset. And then you ask which child would be the most upset. And it's the child who's never been in the hospital before. They don't understand some of the quote dangers. It's actually the child who's been there multiple times. Let's say, like a child with sickle cell disease, they've been in and out. They need IVs. They've been stuck a lot. And maybe it's hurt, or maybe they had bad experiences. But it's that so many times in a hospital, something went wrong. Okay. So again, depends on the child, but the child can act before, during, or after a multi. An adolescent goes to the ER for treatment without the parents. How do you get consent for treatment? There's always going to be a HIPAA question on your NCLEX, guaranteed. And if we're talking about children, this is a great HIPAA question. So, adolescent without parents are in the ER, so they need treatment. Well, number one, the child's awake and alert and oriented, and they're 18, they can sign for their own consent. So, if they're 18 signing for their own consent, you as a nurse must ask that your patient if you can speak to his parents or her parents, because they are in charge of their own information. And that's a HIPAA violation if you don't ask. Now, what if a child comes in rescue on a helicopter? You don't need any consent for anybody. It is assumed, and you'll get the consents as soon as you can. Also, they come in, you call them on the phone, you get two witness telephone consent, and that's how that's done too. And this is in your NCLEX book, and I'm telling you, it's always questions you'll see on it. A child is extremely fearful of hospitalization. What type of play explores fears? We did emotional play, was play therapy, right? Now, what's about what happened that certain, was it CAT scan and that thing going round and round? Or was it the noise of this or that machine? Or was it the room you didn't like? And it's called dramatic play. That's the difference. Play therapy, emotional, dramatic was an event that occurred, and they can express it during that play. When checking an IV on an infant, you notice the tissue around the IV is swollen. What do you do first? Remember, infants, they're tiny. And an ounce of fluid on me or you doesn't make a difference. But when you're talking about an ounce or 30 mLs of fluid on an infant, that could be 3, 4 hours of IV fluid. It's a lot. So, first, even though if it's still a good IV, number one, you're going to stop the infusion. You don't want any more fluid going in there. And then you do your assessment. If you need, you take it out and restart another IV. In helping a child to adapt the hospitalization experience, the best approach, it's going to be in a hospital for whatever. So the biggest thing is that routine. Okay. Number one is parents, right? At the bedside. Those are the best. But number two is then putting in that routine. So that's those things. And then, of course, how do we approach that child? Getting down below them on their level. And then using play for younger kids and, getting them to open up and talk. But routine, big one, especially toddlers. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? Is there any difference between adult and children? What is the difference? It may not be letters or numbers. It might be shapes. Which way are they pointing? Right? Depending on the child age, that's what's going to make that difference here. And it's 20 feet, same thing. A multi. Nursing care of discharging a child home. So you have to take a child, they are going home. Why would you only give instructions to the parents? Young children can read, they want to be involved, and they want to know what's happening. Let them read. Older preschoolers and school age children will, and they should. So it's not just parents. And then, of course, explain it, provide information, telephone numbers, and then making sure they verbalize that understanding of what to do when and what do we want going to happen? What were you going to see with that child? What is the 3-year-old biggest stressor of being hospitalized? 3-year-old, that's the end of toddler. This is the preschooler. What gets them really, really stressed? And that's being away from mommy and daddy. That's the biggest, right? That's the first one you put the piece of the puzzle, and then you put them on a routine. And now you've got two big things to make a happier kid. A multi. What is the best way to relieve stress and anxiety of a hospitalized child? Gee, what's the answer to that one? So the one thing that we've learned is their bed should be a safe place. That you're not going to do bad things. So we don't do invasive stuff there. But the routines, let the parents, and of course, developmentally appropriate. Good job. A nurse notes a string tied around an infant's wrist, an appropriate nursing intervention. Now, there are all sorts of things, religions, cultures, and stuff that they do things. Well, I know that in Miami, I was given this little black thing called an eye to make sure that people didn't have bad thoughts about me. This string could be something like that. Somebody gave it to keep them safe. So never remove these things unless if you don't, it's going to cause harm, like an IV swollen and occlusion of circulation. But ask what it is, and make sure you pass that on in a report. How can a hearing impairment develop? And then when can it develop, right? It's at birth, it's, interutero. I mean, it's infections, especially chronic ear infections. Which urine collection method on an infant is most accurate? Now, let's look at an infant and why do we want accuracy? Remember, infants have no immune system or minimal. They come in and you're suspecting urinary tract infection, and you probably want them on an antibiotic. You want them on the one that's going to take care of that bacteria the first time. You don't want to have to keep bringing them back and keep giving them antibiotics. You could really harm those kidneys, right? So we do a straight calf. It's the most accurate, and we're going to be treating them properly the first time. because we don't want to go 2, 3, 4 different antibiotics. Understand that? Now, older children, if we can get them, and I've seen parents do that, bring them in the bathroom, stand them up on the toilet, have them clean, let them pee, and they catch it as it's coming in. I've seen it on top of sinks, all things. Now, it's okay for older kids, but their immune system's better. On infants, straight calf is the important. Now, I have a question here regarding it. How would you get a little bit of urine for an infant?
Can you repeat the question?
How would you get a little bit of urine for, let's say, just to measure a glucose or a ketone on an infant? And the answer is because every shift when you're working in that area, you do sugar and you do a ketone looking for it, a little cotton ball in the diaper. You could take the piece of cotton, put it inside a syringe and squirt it because it's not clean. You don't need to save it. You just need the urine to touch that little dipstick. And that's always a question. So that's a very important thing I just gave you. A multi. What is the purpose and function of the family? Remember, a family is whatever they say it is. There are so many types of family today. I mean, you have just the traditional, you have, the blended. They're all good families. And purpose of the family, that's your safe environment. And this is where they're growing and learning all of those values, attitudes, beliefs, religions, things that they do. And, family, most of the time, hopefully, is that comfort. It's nothing to do with finances. The family is that one that's that warm hug that gives you everything that makes you you. The primary goal in caring for the child with cognitive impairment is to what? So you have a child that cognitively is delayed. It could be cerebral palsy, Downs, um, autistic, even. These children are delayed. Now, it's our goal. We want them to be the best they can be. Let me give you a little story about a Downs autistic boy. I believe he was 4 years old when I met him. Now, autistic children usually are very difficult to have in a place and to sit and to listen, pay attention. Well, then put on top of that a Downs on top of it. I was at a daycare doing clinicals with Fortis, and the boy comes in, and I'm like, okay, and I was just watching. He went in, put his backpack in the cubby, turned around, sat in the chair. He waited for one of the people to take his vital signs and said, okay, you can go play now. Autistic Downs child followed instructions that explicitly. And why? Routine, 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 routine. Okay. Many infants require oxygen. What type is best tolerated and accurately delivered? We have nasal cannulas on adults. We have masks, intubated, trachs, all of that stuff. Now, infants at birth sometimes are born with like transient tachypnea of the newborn, and they need just a little bit to help. And they don't want things like nasal cannula going to be stuck to their face with tape to hold it in. And they're going to be like that and ripping it off. This oxy hood is clear plastic. They can suck their pacifier, they can suck their finger, and they can look at the environment and they're very happy. And you can really measure it accurately, believe it or not. You can. What is the best practice for school age children with special needs? School age children, special needs. When I was in school, I remember there was a special classroom, right? Today, What they feel is special needs doesn't mean that you shouldn't be blended into the normal routine. So what they're saying today, and it's what they should be and should have been doing, is that children with special needs are integrated into regular classrooms. If a child cannot speak but mentally is smart, why would that child be left in a room where children are not cognitively where you are? They need to be in that regular classroom and learning, and they need to be given the equipment that helps them. I had a friend whose daughter, they found out about 3 years old that she couldn't speak. She could hear, but she couldn't speak. Apparently, at birth, she had some sort of stroke. So this mother fought for this little girl, got her in school, got her in regular classrooms, but it wasn't that she was dumb or didn't understand. They gave her an iPad that she could communicate her wants and needs, and she has thrived in regular classrooms. Years ago, that wouldn't have happened. A multi. Collecting a heel stick blood specimen on an infant. Infants, adults. Well, you don't do heel sticks on adults. But infants, instead of sticking them in their anti-cube all the time, we can do everything but your blood coagulopathies, PTT. The outer aspect, never in the middle, because the middle of the heel is a bone, the calcaneus bone. And if you hit it too deep, it can cause osteomyelitis, okay? The one thing we do is we heat it up with a hospital approved heel warmer. It warms it up, gets it dilated. You prick it on the outside, hold that leg down below the baby's heart. I always get on a chair below, sit below them, and slowly get a little blood. A CBC and a full chem profile is only 1.2 mLs of blood. It's nothing, very little. Referrals for cognitive impairment should include when? So this child is not talking by. This child is not rolling over by 6 months. This child is not walking by 18 months. I mean, when would you refer them for anything? Well, as soon as you figure it out. And the most beautiful thing about children is they catch up really quick. You have a child nonverbal in speech therapy at 18 months. By 3, you can't shut the kid up. They just talk, 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 talk because they got the tools to be able now to communicate. Down's children have frequent upper respiratory infections. And if you look at Down's children, you see that nose, how it's flat? Mucus clogs in there and they can't blow it out. And what happens, it goes out and it starts dripping on the bronchus, trachea, and creates all that mucus and cough. It's that flat, underdeveloped nasal bone. A multi. What would be included in the care plan of a patient with moderate cognitive impairment? What do you think a child that's having a little difficulty thinking and catching up, what do you think would help? So you have child moderate cognitive development impairment. It could be a normal child that's not a Downs or any other thing, or it could be. But the one thing that we do know is the structure. Exposure to all sorts of, see, touch, feel, smell things. Those are great. And the biggest thing, any cognitively delayed child, make sure you're careful with safety because they take everything. How does children explore the world? In the mouth, and guess what? Choke, and now your airway is gone. So again, make sure that they're safe. And of course, these activities are all going to do something. something to teach them a skill. Multi. Autistic children demonstrate which behaviors? So, we have Downs, we know we have Fragile X, we know we have autistic children, and they're all, cognitively delayed in some manner or the other, and they're all a little bit different. Now, autistic children, we don't generally give them, quote, that label till they're about 2 years old. And then why would we go and look for that diagnosis? Because there's language delays. They don't look you in the eye. They sit alone playing with themselves. And when you call them, they're not going to come to you. These are key things you see with children who are autistic. And again, how do we help these children? Speech, physical, occupational, those therapies help them learn how to deal with themselves. And of course, it's that routine, it's that structure. Die. Children with autism have better outcomes if what? Better outcomes. Autistic children, cognitively delayed, inability to express themselves. So here we go. Same thing. Toddler, problems, structured routine. Teach them how to communicate what they need. And just because they're autistic, Downs, or any of those, doesn't mean that they can have bad behaviors. If there's unacceptable, no, it's unacceptable, whether they're a Downs child or not. And therapies only with licensed therapists. What about mom, dad, brother, sister, mommy, daddy, grandma, grandpa at home? Everybody can contribute to that child's better outcome. A multi. Fragile X. Second most common cognitively delayed syndrome. Number one is Downs. These are both very similar, although Fragile X is one that's going to require medications because they're very aggressive. They need their emotional outbursts. They need to be able to relax. So they're on medications. They still have intellectual disabilities, learning disabilities, but they also like have big ears and a jaw. There's physical things that you might see with it. But the difference is they're going to be on medications because of the aggression versus Downs, but very similar. What causes autism? It's immunizations, right? Wasn't it the chickenpox vaccine said many years ago? No, that's not the answer. Um, we don't know. It's everything. Many years ago, this quote, physician, doctor came out with this quote study that says that autism was caused by the chickenpox vaccine. Now, why would that be said? Well, varicella is given about 18 months to 2 years old. And we don't diagnose normally autism till two. So they figured, well, it had to be that chickenpox, the varicella vaccine that caused it. I mean, there probably was hints all the way along, but that's what they felt. Well, this physician, they went back, realized the study was not really a study, and he has lost his license. But it caused a lot of hoopla with mothers, fathers deciding, do I give immunizations to my children? Does it cause autism? Okay. Ways children with hearing impairments communicate with others. What I love is children, whether they're the same language or not, different languages, if they can hear or speak or none of the above, they can sit down and play and have a grand old time, can't they? And it's all about anything. Everything and anything that they do. Amblyopia. It's an eye condition. there are 3 that you need to know about um, with this chapter. So, with your eyes, you see. With amblyopia, some of the muscles don't work good. So it's sort of like gravitates to the right, to the left, to the up or down. They're just not straight ahead the way that they should be. They also cause it a lazy eye. Well, if you have a muscle that don't work well, how do you think you make it work better? You exercise it. So you take the good eye, put a patch on periodically during the day, off and on, and you make that lazy eye muscle work and it re-strengthens it and it'll bring it back to where it needs to be. Amblyopia. It's a lazy eye, one or the other. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? I did 10 years of ER. Um, and I love triage because I had to figure out the kids what's going on and place them correctly. But getting vital signs, especially things like the O2 sat, they thought was going to burn them, and the blood pressure was going to squeeze them, and they don't like it. So I would always make it into a fun time. Taking 2 or 3 minutes to play and have fun with this child will save you 10 minutes of chasing them out to the parking lot because you've scared the bejesus out of them. So I would always have them push buttons or tell me numbers or whatever it was. And then in the end, of course, I always had a sticker. You did a good job. You helped me. Thank you so much. Again, I used play. I had fun with it. Children spending 2 or 3 minutes, I saved a lot of time in the long run. What child may be more stressed when hospitalized? I told you this before. Remember talking about stress. Does it happen before, during, or after? Right? That child who's in and out of the hospital, sickle cell or other, asthma or things that they're in and out, that's the one who's going to be scared because the chances are something's happened, right? Something not the way they sort of wanted, maybe an IV, it didn't go in and they had to be stuck a couple times, or maybe she didn't like one nurse, one assistant, one tech, one whatever, whatever. And again, that's what they remember. A toddler has a hard time fixating on a single point, and the child's eyes move across the midpoint. What it means is you have this eye trying to get and to see this point and this one too, and they can't. And it sort of moves. It's called strabismus. Okay. It's your first time seeing it. Remember, you have amblyopia and now you have strabismus. Strabismus is that you can't focus and your eyes keep trying to get there. A multi. Safety in administering medications to children include what? How do we give medications to children? What do we base it on? Years ago, we used to say, yeah, room 203B. We never called them names. We called them room and bed numbers. And no, we don't do that anymore. Now, yes, there's different ways to give meds, but they say just milligrams, micrograms per kilogram does very well. Very accurate. Always, always, always check a name band. Never check a room. Never ask the child. Always give really good, valid information. An ID band and the milligrams per kilogram. I personally would check every dose the first time I gave a medicine because I didn't want to say, well, I gave double the dose on anything, especially to a child. And when I didn't know, I would ask. What can help the parents to make a baby swallow their medicine? So you put this medicine, especially up to like age 2 or 3. They got it in their mouth. How are you going to get them now to swallow it? You have some children who, oh my goodness, what they go through in order to get medicine down them. So this is what I've taught parents is if you have them on their back and you squirt it to the side of their mouth, and then quick, real quick, not uh, quick, and they swallow it, and it works. Now, years ago, before infection control, I would blow in their face, but today, of course, we don't blow in children's faces anymore. So I teach the parents, the brother, the sister, whoever, and it does work really well. Treatment for amblyopia. Well, what's amblyopia? We have cross the midpoint, strabismus, amblyopia, lazy eye. Look, the little kid has an eye patch on. Why? It's because they've got that lazy eye, and we're going to make the good eye covered, give it a rest, and make that bad eye work. The nurse is discussing sexually with the parents of an adolescent with cognitive impairment. What is important? So you have an adolescent cognitively impaired. This is a real thing. I mean, Down syndrome, anything, or just delayed cerebral palsy. And sexuality is a big thing. People are trying to take advantage of these kids, right? Because that's, today. So, what do we need to discuss? How would we tell parents to work with this? And it is these children need a well defined, concrete code of sexual conduct. What's good touch? What's bad touch? Who should touch you? What should you do when and who should you? And these children, because you have put that in their brain, they're not going to have that possibility as much to be abused in any way. A multi. A child is asking mom about the sibling in a hospital. How can you alleviate his stress and fear? We forget there's kids at home. They're worried about brother and sister. Could have been a car accident, could have been a brain tumor surgery. Um, Now, not all the time can kids go to the hospital for many different reasons. So, how are you going to help the kid at home? Well, honestly, as a nurse, I would always remember the kid at home. If they had a sister and I was making ribbons and bows for the day for my patient, my little girl in the hospital, I would make one to send home to the sister. Or if there was another kid, I would have them draw a picture or a card and I send it the other way back if it was possible, if the kid's condition allowed it. And it does help. We're lucky today. We have FaceTime. We didn't have that years ago. Can you imagine what you did? And children that are home are really a part of the care because they worry about them too. What are some best practices when a child is in pain? One of the things I did working night shift for 20 some odd years that I did, and in pediatrics, newborn ICU, PD ICU, cardiac ICU. At night, I would have a radio on, and I'd have the golden oldies on, upbeat, but it wasn't, rock and roll, but it was nice. And children, believe it or not, with just music in the background and all those other noises, bing, bing, bang, bang, bung, 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 of all those alarms, right? They would rest because there was that humming of music in the background. So again, distraction, huge. And that's the distraction I would use. And that's great on infants and the younger kids. Also, medicine when it's due. Um, Also, they need to get out of bed. They need to do breathing exercises. Medicate them before you want to do that so they don't hurt. And of course, best practices, You have an abdomen that just had surgery and they're laying almost flat. That abdomen stretched. Elevate the head of the bed. You know, put the knees up a little bit. Take the pressure off that tummy. They're multi. Children can be critically ill for long periods. How do you prevent pressure ulcers? Children get pressure ulcers? Yes. And remember, pressure ulcers has a lot to do with nutrition. This is why we're always nutrition, nutrition, nutrition. You have to be worried about those sort of things. So we're going to do everything to keep them dry. Diaper, underpad, whatever. Turning, positioning. Use draw sheet. Just pulling them up will their skin off. It does that shear injury stuff. And with infants and young children, especially like intubated, paralyzed, sedated, I'd have them turned over. I'd have their little beanie babies holding their ET tubes, holding their hand, blanket behind them, just make them look like a little doll inside of all of their little things and looking comfortable for the child, but it was also good for the parents. Seeing their baby look so comfortable, within all of those toys and whatnots. And last question, a multi. Young children can be stressed by being in a hospital. How can you decrease the stress? You know this one. I'm going to say, is it this answer, or this answer, right? So, routine, parents, and then give them things that they know. It's those transitional items, the blanket, the toy, the bottle, the binky, whatever it is. Very good. So we got through week 4. And some Savannah. And number 1, Stacia. Number 4, Denise. And a Casey. So this is the end of this week. I will be posting this as soon as I can. I know it's a long time to wait for your grades, but honestly, overall, they're not bad at all. I will be contacting you if it's crazy, crazy. But honestly, there's nobody here I need to contact. So take a breath. You're going to be all right. And know that if you get your grades on Saturday, if you need me, a one-to-one, anything you need, I'm here to help you. I will walk you through this. If I'm seeing it's math, well, anybody 2, 4, 6, 8 points off for dosage calc, okay? I'll help you through it. Everybody, good night. It's been great. I will see you again next week. Anything, let me know.
Good evening. Take care.